Aloe vera has been used as a natural remedy for centuries and is known for its numerous benefits. This plant, rich in vitamins, minerals, amino acids, and antioxidants, is invaluable for both internal and external use. Benefits for skin health. Moisturizing effect. Aloe vera gel deeply hydrates and softens the skin, healing burns and wounds. It soothes sunburns, minor cuts, and skin inflammation while promoting skin regeneration. Fights acne. Its antibacterial and anti-inflammatory properties help reduce acne problems. Anti-aging effect. Antioxidants improve skin elasticity and delay the formation of wrinkles. Benefits for hair and scalp. Strengthens hair. Aloe vera nourishes hair roots, making them healthier and reducing hair loss. Fights dandruff. Reduces scalp inflammation and prevents dandruff formation. Moisturizing effect. Adds shine and softness to hair. Benefits for the digestive system. Relieves constipation. Aloe vera contains compounds that improve bowel movements, reduces digestive issues, balances stomach acid, and alleviates problems like stomach ulcers, supports gut health, promotes the growth of beneficial bacteria for a healthy digestive system. Strengthens the immune system. Its vitamins C, E, B, and minerals zinc, magnesium boost immunity. Its antioxidant properties protect the body from free radicals. Regulates blood sugar and cholesterol levels. Balances blood sugar. Helps stabilize blood sugar levels, especially in type 2 diabetes patients. Lowers cholesterol. Reduces the risk of cardiovascular diseases. Anti-inflammatory effect. Aloe vera reduces inflammation in the body and alleviates symptoms of conditions such as arthritis and other inflammatory diseases. Usage guidelines. Internal use. Aloe vera juice pure or mixed with water can be consumed, but it's important not to exceed the daily recommended dosage. External use. Aloe vera gel can be applied directly to the skin or hair. Before using aloe vera, consult a doctor, especially if you have allergies or health concerns. Overuse or improper use may lead to negative effects, for example, constipation. You can easily incorporate this natural plant into your daily routine for both health and beauty. The side effects of aloe vera primarily occur when it is not used correctly or in individuals who are sensitive to it. Both internal and external use may lead to some adverse effects. Side effects of internal use. Constipation or diarrhea. Compounds like allicin in aloe vera can overstimulate the intestines, causing diarrhea or, with long-term use, bowel issues. Liver and kidney strain. Excessive use can negatively affect liver and kidney functions. Electrolyte imbalance. Long-term use can lead to an imbalance of electrolytes in the body, especially a decrease in potassium levels. Allergic reactions. Some individuals may experience allergies, nausea, or vomiting when aloe vera is consumed internally. Side effects of external use. Skin irritation and allergies. People with sensitive skin may experience irritation or redness when using aloe vera gel, especially if it contains chemical additives. Photosensitivity. After applying aloe vera, some individuals may experience increased sensitivity to sunlight, leading to burns. Delayed wound healing. In some cases, aloe vera can slow the healing process of deep wounds. During pregnancy and breastfeeding. Risk of premature labor. Internal use of aloe vera can stimulate uterine muscles, potentially increasing the risk of premature labor in pregnant women. Impact on breast milk. Certain compounds in aloe vera may transfer to breast milk and cause digestive issues in infants. Effects on chronic conditions. Diabetes. Aloe vera can lower blood sugar levels. Diabetic patients using insulin or medications may experience excessively low blood sugar if aloe vera is used simultaneously. Hypotension. Aloe vera may lower blood pressure, so individuals with low blood pressure should use it cautiously. Allergy risk. People allergic to garlic, onions, or tulips may also be sensitive to aloe vera. Improper storage. Fresh aloe vera gel, if not stored properly, for example outside of refrigeration, can encourage the growth of bacteria and fungi, making it harmful for skin or internal use. Recommendations and safety guidelines. Do not exceed the recommended dose. Overuse increases the risk of side effects. Conduct a patch test. For external use, test aloe vera gel on a small area of skin first. Choose pure products. Avoid products with chemical additives whenever possible. Consult a doctor, especially if you have chronic conditions. Seek medical advice before using aloe vera. Although aloe vera is a highly beneficial plant, it is essential to use it cautiously and appropriately. By following safety precautions, you can make the most of its benefits. Dear viewers, if you liked my video, don't forget to subscribe and support me.